Today we are discussing hip osteoarthritis. How do you know if you have it? What are the best exercises to do? And what are your options if that's not working? Hi, I'm Rob from AMR Physio, and hip osteoarthritis, more commonly referred to as hip OA, is a very painful condition normally felt in the groin area, but it can also be felt on the outside of the hip and the buttock, and sometimes even down into the knee. A main test that will be used to check if it is the joint is going into more internal rotation, as this will close the joint down. Doing this actively, so you're doing it yourself, but also passively, so you're not using any muscles to do it. If this is painful, it would suggest it's the joint that's the issue. A really common one is also trying to put your shoes or socks on that you notice becomes more painful. If that's only slightly painful, you can intensify by adding them together, so a flexion, adduction and internal rotation, so a fader movement. Now, this can just be uncomfortable anyway for most people. It's more that it brings on your pain and symptoms to know that you have it. The clear-cut way to know for sure if having it is by getting an X-ray, and this is where it will be graded in severity from early, mild, moderate or severe. You don't want to just use the X-ray to diagnose though, as people may have OA on an X-ray, but symptoms are actually due to something else. What we're going to do in today's video is first go through the 5 best exercises to do for this, and then discuss what other options are available if you're not finding any benefit. Number 1 is heel slides. This is a starting exercise if really struggling with pain. Move the heel as far back as is comfortable. It's really important to keep the joint moving, as this helps promote synovial fluid and almost lubricate the joint. It's why you'll commonly find that initial movement, like getting up from a chair, is most painful after you've been sat still for a while. It's also important to not aggravate too much at the same time by doing loads of movement. I tend to explain it like trying to find the Goldilocks zone, which will be slightly different for everyone. Don't move enough, it'll be stiff and sore. Do too much and it'll be painful. It's trying to find that middle ground and knowing your limits. To progress the heel slide, you can try an active straight leg raise to incorporate some more strengthening within the quad muscle. Number 2 is a hip abduction, so start off trying this in standing. Again, only go as far as is comfortable. If that feels quite easy, you can progress it to sideline to get a bit more strengthening into the glutes. Again, only as high as what you find comfortable. Number 3 is sit to stand. This will help to get the joint moving, but also help with general strengthening of the leg. Strength becomes really important to help minimize falls risk. Start at a level reasonably high, like from the bed, but if it gets too easy, then go to a lower surface like a chair, just ensuring that it's not aggravating things. Number 4 is balance, another important one to reduce falls risk. You want to start at a level with your feet together, where it challenges balance, but it's also safe. Just make sure you have somewhere to hold on to. You can then progress to make this harder by having your feet further apart, then go on to a toe, and then finally a single leg. But again, only work on that if it's feeling safe. Number 5 is bridging. This you can do laid on the floor or on a bed if you struggle to get down to the floor, lifting your bum in the air and contracting the glutes at the top of the movement. Doing the exercises comes with a little asterisk, that this will also be combined with activity modification. So for a lot of people, doing too much activity can make symptoms worse overall, such as walking long distances. So ideally, you want to be pacing activity and stopping or taking breaks before it gets aggravated. This includes if getting a lot worse pain the next day is likely an indication you did too much on previous days. Now, what do you do if you're not feeling benefit from the exercises and modifying your activity? Well, a lot of that will come down to the severity of OA you have on an X-ray, and then it's been confirmed that your symptoms are due to your hip joint. The first step will normally always be a non-invasive approach, such as trying the exercises, as a lot of people will get benefit from that and there's no real adverse side effects. Most are all positive, like getting a bit stronger or fitter. The next step is to go slightly more invasive, which may involve a steroid injection into the joint. This won't get rid of the OA, but can give relief from pain, and especially useful if pain is stopping you working on any of these exercises. This can give a window to then get that longer term benefit. It can also be used as a diagnostic. If you're unsure it's related to your hip, if you get good relief from the injection, then you can be confident it was due to that hip. The next step is a surgical one in the form of a hip replacement. Sometimes this may be one part, like the ball or the socket being replaced, but often it's a total replacement including both. This is usually done if the OA is moderate or severe, but this obviously comes with increased risk having surgery. However, if the pain is really bad, not improving, really affecting quality of life, then this will be the best option for some. In terms of doing the exercises, we have a video here that goes into more detail of the reps and sets to complete and how to build this up, and more details on activity modification. So check that out if needing more information on that side of things.